And welcome back to the Morning Blend. It's been a tough year to say the least. The pandemic and the civil unrest has taken its toll on the state of our mental health. Senior medical science liaison and lead scientist at Genomind, Dr. Daniel VanDorn, joins us to discuss the latest breakthrough in genetic testing. Good morning to you, Doctor.
Good morning. Thank you for having me.
Absolutely. There's so much, I think, stress right now and anxiety. So many people social distancing, especially for the holiday season, not being able to see relatives, friends, and family. And I think it really takes a toll on some people's mental health. Would you agree with that?
No, absolutely. This has had a profound effect on our mental health. And not just for the holiday season, but for an entire year, we've been living with a sense of fear and loss that is pervasive and constant, all while being denied the normal social coping strategies that would normally help us recover. Now, this is particularly poignant during the holiday season and going into the new year, and those who are struggling with their mental health are particularly vulnerable.
Yeah, so what do you suggest to sort of stay on top of our mental health as we head into this new year?
I'd say the first thing to do is to realize, when we're making our New Year's resolutions, for example, that our mental health is just as important as our physical health. And just like our physical health, there are things that we can do to support and sustain our mental health. And that's why I'm really excited to share new technology, new tools that allow us to take a more personalized approach to resources that allow us to do this. I'm talking about genetic testing. And so this is based on a model that we call Mental Health 360. And this model shows us that mental health is a function of our genetics, our environment, our lifestyle, and our experiences. Now, traditionally, we've only had access to 3 out of those 4 factors. Genetic testing unlocks that 4th critical piece that provides a more comprehensive and complete view of our mental health. Now, there are 2 genetic tests that we offer that I'd like to introduce you to. The first of these is called Genomind Professional PGX Express. And so this is a prescription genetic test. That means it has to be ordered by a prescribing clinician, it has to be ordered by a doctor, because it informs on medication therapy for depression, anxiety, ADHD, and many other conditions. It surprises many people that the FDA actually provides genetic-based guidance for many of these medications, showing, basically suggesting changes in dose or avoiding a drug altogether to avoid serious adverse effects. So the Genomind Professional PGX Express, it offers smarter, personalized prescriber guidance for life. Now again, that's the prescription test. The new offering, something that we just launched, is considered a breakthrough in mental health, is a new genetic test called Genomind Mental Health Map. Now this is offered without a prescription and actually includes 7 different genetic reports that allow us to explore how we are wired, how we are predisposed to react to our environment in certain ways and display certain behaviors. For example, some people are genetically predisposed towards a heightened stress response. This is essentially a biological stress sensitivity. These individuals in the mental health map, in their stress and anxiety report, would be provided personalized guidance on how to improve their stress resilience. Other predispositions we look at are habit-forming potential, eating behavior, emotional eating, focus, and multiple aspects of sleep. Now, the prescription test, the Genomind Professional PGX Express, is for a clinician to use with their patients, whereas the Genomind Mental Health Map is for everyone, because mental health is important for everyone. And it really is essentially the new expert starting point for mental health and wellness.
Quickly, doctor, I could see how this could be so helpful in terms of medication, like you mentioned, but also for things like therapy. Cognitive behavioral therapy is just one example that is helpful in the treatment of anxiety, in guiding how a person can get well and stay well.
No, absolutely. And we know that medications alone are not nearly as effective as when you combine medication therapy with cognitive behavioral therapy, with that other aspect that looks at what we can do for ourselves to take ownership of our behavior. So these are 2 tests that look at those 2 different spectrums, those 2 different solutions for mental health. To learn more, your viewers can go to genomind.com, where they can learn all about these 2 genetic tests and what solutions they can offer for them.
Thank you so much for your time, Doctor. We appreciate it.
Thank you so much for having me.
Absolutely.